Good morning, good afternoon, and good evening. Your Excellencies, colleagues, ladies and gentlemen, welcome back. Before we begin, I understand from the Secretariat that a delegation has raised their hand and requested to take the floor. I shall hand over to the Secretariat to give the floor to the delegation on the virtual platform. Secretariat, you can have the floor, please.
Thank you, Mr. Chair. I recognize the delegation of the United States of America. US, you have the floor.
Thank you, Madam Moderator. Thank you, Mr. Chairman. Director General Dr. Tedros, distinguished representatives, friends, and colleagues. It is an honor for me to be here representing the United States of America on behalf of the newly inaugurated Biden-Harris administration and as the Chief Medical Advisor to President Biden. I also am here to represent the scientists, public health officials, and frontline healthcare workers and community health workers who have worked so heroically this past year to fight COVID-19, developing medical countermeasures at truly phenomenal speed, adapting policy responses as we learn more about the virus, and courageously treating the millions of people who have been stricken by this historic scourge. 1 year ago, to this very day, the United States confirmed its first case of SARS-CoV-2 in the state of Washington. Today, in my country and around the world, we have surpassed 90 million cases, a devastating number that continues to grow. I join my fellow representatives in thanking the World Health Organization for its role in leading the global public health response to this pandemic. Under trying circumstances, this organization has rallied the scientific and research and development community to accelerate vaccines, therapies, and diagnostics, conducted regular streamed press briefings that authoritatively track global developments, provided millions of vital supplies from lab reagents to protective gear to healthcare workers in dozens of countries, and relentlessly worked with nations in their fight against COVID-19. I also know firsthand the work of WHO, with whom I have engaged in a collaborative manner, touching all aspects of global health over the past 4 decades. And as such, I am honored to announce that the United States will remain a member of the World Health Organization. Yesterday, President Biden signed letters retracting the previous administration's announcement to withdraw from the organization. And those letters have been transmitted to the Secretary General of the United Nations and to you, Dr. Tedros, my dear friend. In addition to retracting the notification of withdrawal and retaining membership in the WHO, the United States will cease the drawdown of United States staff seconded to the WHO and will resume regular engagement of U.S. government personnel with the WHO both directly and through our WHO collaborating centers. The United States also intends to fulfill its financial obligations to the organization. The United States sees technical collaboration at all levels as a fundamental part of our relationship with WHO, one that we value deeply and will look to strengthen going forward. As a WHO member state, the United States will work constructively with partners to strengthen and, importantly, to reform the WHO, to help lead the collective effort to strengthen the international COVID-19 response and address its secondary impacts on people, communities, and health systems around the world. The Biden administration also intends to be fully engaged in advancing global health, supporting global health security and the global health security agenda, and building a healthier future for all people. I am also pleased to announce today that the United States plans to work multilaterally to respond to and recover from the COVID-19 pandemic. President Biden will issue a directive later today, which will include the intent of the United States to join COVAX and support the ACT Accelerator to advance multilateral efforts for COVID-19 vaccine, therapeutic, and diagnostic distribution, equitable access, and research and development. The United States will also work with the WHO and member states to counter the erosion of major gains in global health that we have achieved through decades of research, collaboration, and investments in health and health security, including in HIV/AIDS, food security, malaria, and epidemic preparedness. And it will be our policy to support women's and girls' sexual and reproductive health and reproductive rights in the United States as well as globally. To that end, President Biden will be revoking the Mexico City policy in the coming days as part of his broader commitment to protect women's health and advance gender equality at home and around the world. Now, we realize that responding to COVID-19 and rebuilding global health and advancing health security around the world will not be easy. And in this regard, we are committed to transparency, including those events surrounding the early days of the pandemic. It is imperative that we learn and build upon important lessons about how future pandemic events can be averted. The international investigation must be robust and clear, and we look forward to evaluating it. We also will work with the WHO partner countries to strengthen and reform the WHO, improve mechanisms for responding to health emergencies across the United Nations, and strengthen the international health regulation. We will commit to building global health security capacity, expanding pandemic preparedness, and supporting efforts to strengthen health systems around the world and to advance the Sustainable Development Goals. We will work with partners to develop new international financing mechanisms for health security. We will seek an improved shared system for early warning and rapid response to emerging biological threats. We will support scientifically robust and ethically sound collaborative science, research, and research capacity building, as well the rapid sharing of research results, pathogen samples, and data essential to research progress. We will look to strengthen pandemic supply chain networks, and we will work with partners around the world to build a system that leaves us better prepared for this pandemic and for the next one. And finally, given that a considerable amount of effort will be required by all of us moving forward, the United States stands ready to work in partnership and solidarity to support the international COVID-19 response, mitigate its impact on the world, strengthen our institutions, advance epidemic preparedness for the future, and improve the health and well-being of all people throughout the world. Thank you.
Thank you. Thank you so much, my brother Tony, and welcome to the WHO Executive Board as head of delegation for the United States of America. Thank you, my friend, for your personal support for WHO over many years, and especially in the past year. We have benefited immensely from your participation as a member of our regular global health leaders' calls since the start of this pandemic. And thank you for your incredible leadership against the pandemic in the United States. This is a good day for WHO and a good day for global health. The role of the United States, its role, global role, is very, very crucial. And I send my deep thanks and warm congratulations to President Biden and Vice President Harris and to the American people. Thank you, President Biden, for honoring your pledge to maintain the membership of the United States in WHO. And thank you for your commitment to join COVAX and support the Access to COVID-19 Tools Accelerator. In my report to the Executive Board on Monday, I said that we must work together as one family to ensure vaccination of health workers and other high-risk groups is underway in all countries within the first 100 days of 2021. With your commitment, we're one step closer. Since WHO's founding in 1948, the United States has played a vital role in global health, and the American people have made enormous contributions to the health of the world's people. We look forward to continuing this partnership, as I know all member states do. We have a lot of work to do and lessons to learn to end the pandemic and to meet the long list of global health challenges we face. But the world will be better able to meet them with you. Tony, we send our support and best wishes to you, President Biden, Vice President Harris, the new administration, and the American people as you work together to save lives and bring the pandemic under control. I assure you of WHO's continued commitment to support you with science, solutions, solidarity, and service. WHO is a family of nations, and we are all glad that the United States is staying in the family. We are family. I thank you. I now give the floor to Dr. Tim Armstrong, Director of Governing Bodies.
Thank you very much, Director General Tedros. I understand that a number of member states have raised their hands on the Zoom platform. Following consultation with the Chair of the Executive Board, any member state wishing to take the floor in response to the intervention made by the United States of America is invited to do so at the beginning of your intervention under the next agenda item. And with that, I would now like to hand the floor back to you, Honourable Chair Dr. Harshvardhan of India.
Thank you. We shall now continue our consideration of sub-items 17.2, update on the financing and implementation of the program budget 2020-21, and 17.1, proposed program budget 2022-23, and turn to the second part of our discussion on sustainable financing. This includes consideration of a draft decision on sustainable financing, which is contained in document EB 148/26 add 1. The financial and administrative implications of this draft decision, should it be adopted, are contained in document EB 148/26 add 2. The floor is now open for discussion. I would like to request that the Secretariat moderate the discussion on the virtual platform. Secretariat, you have the floor, please.
Thank you, Mr. Chair. I recognize the delegation of Austria to be followed by Chile. Austria, you have the floor.
Thank you very much, Mr. Chairman. I have the honor of delivering this statement on behalf of the European Union and its member states. The European Union and its member states welcome the announcement made by the United States of their support for WHO. We welcome the new administration's commitment to multilateral diplomacy and international alliances. The European Union looks forward to working closely with the United States to strengthen the United States' ability to address global challenges. It is time to renew joint EU-US efforts aimed at strengthening as well as reforming international organizations such as the World Health Organization. Thank you very much.
Thank you, Austria. I would now like to invite Chile to be followed by Finland. Chile, you have the floor.
Muchas gracias, señor presidente. La delegación de Chile da la bienvenida al anuncio hecho por Estados Unidos referido a su permanencia en la Organización Mundial de la Salud. La crisis sanitaria y socioeconómica generada por la pandemia COVID-19 requiere del trabajo coordinado y conjunto de todos los actores del sistema internacional. Durante esta sesión del Consejo Ejecutivo se ha dicho en reiteradas ocasiones que la única forma de superar esta pandemia y otras emergencias de importancia internacional que se pueden presentar en el futuro es sumando los esfuerzos de todos. Del mismo modo, resulta evidente el rol fundamental del liderazgo que le corresponde a la OMS en esta tarea, por lo que la renovación del compromiso de Estados Unidos con la organización replica también la voluntad de todos los estados, parte de buscar a través del multilateralismo las herramientas necesarias para no solo la superación de la pandemia, sino también para el logro de la cobertura sanitaria universal a nivel global. Finalmente, invitar a Estados Unidos a sumarse a la iniciativa de nuestro país, que junto con otros países estamos trabajando para entregar propuestas concretas para fortalecer la actual normativa vigente, con modificaciones y actualizaciones, considerando la experiencia que hemos vivido con la actual pandemia, fortaleciendo la actual arquitectura mundial de la salud global. Asimismo, que se sume a los esfuerzos para llevar a cabo el desempeño del envejecimiento saludable de la mejor manera posible. Muchas gracias, señor presidente.
Thank you. I would now like to invite the delegation of Finland to be followed by Gabon. Finland, you have the floor.
Chair, Finland aligns herself with a statement delivered on behalf of the EU and its member states. We welcome the continued cooperation with the United States in the context of WHO and global health. Strong multilateral cooperation is critical in responding to one of the most severe crises of our time, in strengthening our future preparedness and response capacities, and in promoting the health and well-being in our population. The support, expertise, and engagement of the United States are highly valued, and we work forward to working together for global health and health security. Considering the proposed stepwise approach to developing solutions of WHO sustainable financing, we feel that it is necessary to reconsider the proposal of the Secretariat to establish an open-ended working group for the first phase of the process. Based on previous experience of intergovernmental negotiations, I would like to ask, would it not make more sense to have
Finland, we apologize. There are some small technical issues. There is an echo. Our colleagues will try to regulate it. Maybe we can go to Gabon and we will come back to you after the delegation of Gabon has spoken.
Okay.
Gabon, you have the floor. Thank you, Finland.
Je vous remercie, Monsieur le Président. Le Gabon a l'honneur de prendre la parole au nom des 47 États membres de la région africaine. Je voudrais aussi féliciter de l'annonce faite par les États-Unis de continuer la poursuite de sa coopération au sein de l'Organisation mondiale de la santé. La région africaine, pour revenir donc au point concernant le financement durable, je voudrais remercier le secrétariat pour ce rapport qui met en exergue le modèle actuel de financement du budget programme de l'OMS et les niveaux de financement caractérisés par la limitation des contributions fixes et des fonds souples avec les problèmes qui en découlent. En effet, la pandémie de Covid-19 a permis de relever les cas d'actions de notre organisation et ce qu'elle est en mesure de réaliser avec les ressources et les capacités mises à sa disposition. Cette situation va ressentir le niveau faible qui sont alloués aux domaines prioritaires sous-financés, des maladies non transmissibles et des situations d'urgence sanitaire. Monsieur le Président, nous sommes préoccupés par l'atteinte des objectifs de développement durable et des cibles triple milliards qui font l'objet du programme général de travail. Nous aimerions souligner que le financement durable est essentiel pour la sécurité sanitaire mondiale et constitue un défi important à relever pour notre organisation qui a pour mission de promouvoir la sécurité, préserver la sécurité mondiale et d'être au service des personnes vulnérables. Nous partageons la pertinence des tâches d'intervention stratégique qui influencent l'exécution du projet du programme de 2023. À cet effet, la date de réalisation des 6 milliards de recettes prorogées jusqu'en 2025, afin de permettre de réexaminer leurs besoins, leurs priorités et leurs stratégies. Le fait qu'un financement durable est assuré que pour 17% du budget de l'OMS nous paraît problématique, surtout avec la forte dépendance de l'OMS à l'égard des contributions volontaires des donateurs. Eu égard à cette situation, la région africaine insiste sur la nécessité de repenser la préparation aux situations d'urgence et renforcer la riposte, rattraper le retard et accélérer les progrès accomplis en vue d'atteindre les cibles du type de milliards et celles des objectifs de développement durable. Le renforcement de la résilience par le biais de la consolidation des systèmes de santé axés sur les soins de santé primaire et la promotion du rôle de chef de file de l'OMS dans le domaine de la science et des données constitue également une priorité. Dans ce cadre, la région africaine appuie le processus proposé par le secrétariat et le calendrier élaboré pour parvenir à une solution concrète de financement durable de l'OMS sur une approche rigoureuse et méthodique fondée sur les questions pratiques liées à la nature et aux ressources de financement. Nous sommes convaincus que le financement durable pourra nous permettre d'obtenir les résultats dans le cadre du 13e programme général de travail. Nous soutenons à cet égard la mise en place du travail intergouvernemental dédié à ces faits auxquels la région africaine peut participer. Le groupe africain estime qu'il y a lieu de s'appesantir sur la question de l'intensité des fonds consacrés au programme. Enfin, l'Union africaine prend note du rapport du directeur général et recommande au Conseil d'adopter le rapport. Je vous remercie.
Thank you, Gabon. Finland, can we go back to you to try the sound, please? Finland, you have the floor.
Thank you. Do you hear now me better?
Yes, very well. Very good.
Okay.
Thank you.
Did you hear the first part of our statement?
Yes, we started having issue when you talk about sustainable financing.
Okay. Considering the proposed stepwise approach to developing solutions to WHO's sustainable financing, we feel that it is necessary to reconsider the proposal of the Secretariat to establish an open-ended working group for the first phase of the process.
Excuse me,
Based
Finland.
on previous experience from intergovernmental negotiations, we would like to ask, would it not make more sense to have a smaller cross-regional group work on initial options for further discussions in an open-ended process in the second phase? Finland would be supportive to returning to the matter later during this EP to consider a revised proposal by the Secretariat. Thank you.
Thank you, Finland. I would now like to invite the delegation of Tonga to be followed by the Russian Federation. Tonga, you have the floor.
Honorable Chair, WHO Director General, Your Excellencies, on behalf of His Majesty's Government of the Kingdom of Tonga and the Pacific, we would like to welcome the announcement given by Dr. Fauci on behalf of the United States. We thank you for your commitment to COVAX and your commitment to sustainable financing to WHO. Absolutely, this will ensure equitable access for vaccine, especially for countries without wealth, and of course in the Pacific. Honorable Chair, I thank you for the report. Thank you.
Thank you, Tonga. I now recognize the delegation of the Russian Federation to be followed by Indonesia. Russian Federation, you have the floor.
Благодарю вас. Всем доброго времени суток. Вопрос устойчивого финансирования является краеугольным для успешной реализации стоящих перед ВОЗ задач, одобренных государствами-членами. Для рассмотрения этого вопроса необходимо провести глубокий анализ и подробную инвентаризацию программной деятельности ВОЗ для выявления наиболее приоритетных и отвечающих изначальным и реальным целям ВОЗ направления деятельности и исключить устаревшие, малоэффективные и непрофильные для организации мероприятия. Кроме того, необходимо исключить или существенно пересмотреть виды деятельности, которые дублируют или повторяют функции других международных организаций, и сконцентрироваться на тех вопросах, где ВОЗ имеет очевидные преимущества с учетом своего мандата. Также необходимо повысить объем предоставляемой финансовой информации. Отдельно хотели бы подчеркнуть, что употребляемый сейчас термин «гибкие ресурсы» в отношении обязательных взносов может ввести в заблуждение. Обязательные взносы должны расходоваться в соответствии с объемами, одобренными государствами-членами в отношении каждого конечного результата базового сегмента программного бюджета. В контексте поиска оптимальных методов достижения финансовой устойчивости ВОЗ на практике в позитивном ключе отмечаем предложение генерального директора о создании межправительственной рабочей группы открытого состава при технической поддержке секретариата. Речь должна идти о поиске решения, принятого на основе консенсуса и отражающего подходы всех государств-членов, что в свою очередь должно привести к обеспечению независимости ВОЗ посредством укрепления ее финансовой стабильности. Российская делегация поддерживает проект решения, содержащийся в документе ИБ 148/26 Аддендум 1, и мы были бы признательны секретариату за его комментарии, как это решение будет реализовываться на практике. Благодарю вас.
Thank you. I would now like to recognize the delegation of Indonesia. Indonesia, you have the floor.
Thank you, Chair. Report under this agenda item